Good morning, good afternoon, and good evening to Dr. Pronu and my fellow classmates. I am Shun. Today I'm going to cover Cluster C in Personality Disorder. Okay, I will present Introduction, Etiology and Treatment of Avoidant Personality Disorder, Dependent Personality Disorder, and Obessive Compulsive Personality Disorder. But another personality disorder will also cover in this presentation. So, what is cluster C personality disorder? They are classified as anxious and fearful behavior. They share characteristics with anxiety disorder. There are three types of personality disorder in cluster C, which are avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. Okay, now, what is avoidant personality disorder? The main characteristic of this disorder is avoid. Individuals with this personality disorder will experience with a long-standing feeling of inadequacy and low self-esteem. They seek to avoid work, school, and any activities that involve socializing or interacting with others because they are fear of rejection. They seem to very sensitive to criticism. They will blame themselves for things that go wrong and they find very little pressure in their life. Okay, study indicate that childhood for a person with avoidant personality disorder engage in fewer extracurricular activities, hobbies, and leadership roles because they had less ability and less popular in school. People with this personality disorder thus desire for affection and an active social life, but they fear for social contact. This is because their deficit of social skill may invite criticism from others. In other words, their fear of criticism may lead to criticism. They often feel depressed, anxious, angry at themselves, inferior, and inadequate into their elderly layers. If it is diagnosed in a child or teen, the features must be present for at least 1 year. They occur in less than 1% of population and no gender differences are apparent. Okay, now I'm going to proceed to diagnostic criteria of avoidant personality disorder in DSM-5, but I'm not going to read one by one. So, for diagnostic criteria in DSM-5, you can refer to this book in page 328. Okay, please let me know if you got any question. Okay, before I proceed to next slide, I would like to show you guys with a video of avoidant personality disorder. Please enjoy this video.
Hello and welcome to my second posting about Avoidant Personality Disorder. Well, hell. What have I done? I began to speak. Or type anyway, and now I cannot seem to stop. People with avoidant personalities do not take many chances to express themselves, so it builds up. And at the moment I seem to be feeling brave. Well, brave enough to post things anonymously and to speak through a cartoon character anyway. Even so, I still have a horrible fear that my family and coworkers will connect this with me. The great fear of people with avoidant personalities is that people will know they have avoidant personalities, as if it isn't obvious. And I already know that when my fear returns again, I will be upset that I revealed so much about myself. But still I am driven now. I feel a little like a real person today. I hope Miss Big Cool Planet will not mind my mentioning her again. She said that she could not explain how she came to have an avoidant personality, that you would have to see her whole life to understand. I know that feeling, but I think I can try to explain my own case. And for some reason, I've wanted to try and explain it for a long time. I hope you will want to understand and be patient with me. And remember, this is my case. I can speak for no one else. First, there's nature versus nurture. Are we born the way we are, or are we taught to be the way we are? Research shows it is about 50-50. Half of personality can be explained by biology. The other half, by the way we are raised. My family has many anxious, depressed, shy and addicted people. It is safe to say these things run in the family. My natural nervousness and depression and shyness made it easy for me to develop my personality problems. I was set up for avoidant personality, but it was not inevitable. But I want to focus on how I was raised and taught. First, I was not abused physically or sexually. A couple of people outside my family tried to molest me, but I was lucky to be able to see what was happening, and no one ever actually touched me. And like I said in my last post, there is nothing unusual about my body or mannerisms, and I am a very intelligent person. There is nothing about me that might naturally cause me to feel ashamed. I was a very shy and socially awkward child. One thing that both of my parents had in common was their frustration with this part of me. They were often angry with me for being awkward, and asked me to stop it. As if I could. As if it were a choice. My being awkward drew me a great deal of criticism as a child. I can't describe my father in 3 words: frightened, angry and rigid. I can't describe my mother in 3 words too: frightened, dependent and faceless. It is safe to say they both have personality disorders as well. My father is so scared of change that he demands that the whole world obey his rules. The fear becomes his need for control. Absolute control over what family members think and feel. And although he was so very angry, he could not tolerate any feelings, especially anger, from his children. We were supposed to be compliant and to always think as he did, no matter how ridiculous. I remember at 11 years old my father angrily chewing me out, red-faced, eyes bulging, nose to nose with me. Then he scolded me for, in his words, looking like a whip pup. But I was a whip pup. He would also do things like chew me out, then reach to my face and form a smile out of my mouth with his fingers. How intrusive. So fear and anger were not permitted emotions from me. I should say that my father's rages were frequent and unpredictable. There was no telling what might be the next thing that set him off, sometimes within seconds. My father was also very embarrassed by my childish behavior. And despite being a child, I was too. But how else does a child know to act but childish? Playing in his presence or even showing affection would make him so uncomfortable. Acting according to the expected role was very important too. I grew up in the touchy-feely express yourself 1970s. But for my father, any expression of anything feminine was forbidden. And having and talking about emotions was definitely woman's stuff to my father. Although I am straight and have never had a same-sex lover at all, to this day my father suspects that I am gay. Especially because I have for the past 5 years had no lovers but 1 or 2 brief flings. I think my father really wanted me to come out of the womb as a junior executive, wearing a suit, and plotting my next masculine step up the corporate ladder. I learned early that my father was completely emotionally unavailable and that it was best to avoid interacting with him at all costs. My mother is very compliant and dependent. She always strives to say exactly what it is my father wants to hear, what she is supposed to say. But my father is an angry misogynist. He hates and fears women. And I can understand. I know his mother. So what he wants is for my mother to be wrong so he can angrily correct her. It is a game they play. She tries to guess what she should be at any given moment, and he finds a way to be offended with her. That is why I call her faceless. She has no identity but has different roles she puts on. She was never genuinely herself. I grew up trying to relate to a woman who had no self, but just acted out a number of rigid and poorly fitting roles. And this was her fear. That someone would criticize her for not being the right person, for not playing the right role. I think she is very avoidant and that she cannot let even her children see that she is a real person. I can understand this. I cannot stand the idea of my parents truly knowing me. So again, she was a parent who insisted that I play roles, but never express who I actually am. What was more important was to keep everything looking happy and healthy from the outside, even if we were all sick at heart, and at each other's throats. Yes, we had to be the happy family from the outside. I remember in 7th grade, I sought the attention and laughter of my schoolmates by writing the most horrible and gruesome sentences for English homework. When the school counselor called my mother, she was mortified. She was angry. I was chewed out for making someone think there was something wrong. I did not dare to speak it, but I thought to myself, "Mother, there is something wrong." Me. I'm so sick with fear and sadness. I just beat up my only friend because I thought he was mocking me. Mother, the other day I put a gun in my mouth but was too scared to pull the trigger. I screamed silently in my mind. The entire incident was ignored after I was told not to be attention-seeking. Attention-seeking. That was my parents' explanation of all my misbehaviors. And I had many misbehaviors. I was told again and again, "You were just being attention-seeking," when what I really wanted was to become invisible and disappear from even other people's memories. I heard that so often, attention-seeking. I learned that to draw attention to oneself was not only painful, but wrong. I tried to learn to creep on tiptoes in the house so I could not be heard. I silently listened to the voices of others through the walls. I learned to keep myself silent. These were the coping skills I tried to learn. But most of times, I was explosive, vulgar, resentful and ugly. Very, very ugly. I was a horrible child to raise. At these times I wanted nothing more than to destroy my family's rules, to shake off all of the masks we were supposed to wear, even if... No. Especially if I had to destroy my family and myself to do it. But of course, I only helped my family cling to their roles and masks even more. Another thing, I understand the power of positive thinking. Thinking positively helps us reach our goals and to feel happy. But my mother took this to a very unhealthy extreme. Her way of trying to change me was to imagine who she wished I were and then act as if I were that person. She is always surprised and puzzled by me, because I do not match who she believes that I am. Not long ago, she mentioned my incredibly troubled, angry teen years. She told me, "That's all gone. I don't even think of that as you. It never really happened." Once again, I was silent, but screamed in my head because she was trying to change me through her fantasy and to amputate part of my life. A horrible, ugly part. But it is mine. It is my history. It made me who I am. I should also add that my mother's style of punishment was to save a great deal of resentment and then explode verbally. This almost always included expressions of how disgusting I was physically and of contempt. My mother, being very passive-aggressive, often lost no chance to suggest that I was soiled, or smelly, or unclean somehow. And didn't I say there were other children? Yes, my sister. We had no relationship, really, other than sharing a house and mutual contempt. She was the good child, the compliant child. The one who made no problems, usually made no problems. Who usually made no problems bigger than the ones I made. She suffered as deeply as I did. But we were no help to each other, and would have not even known where to start having a loving relationship. Not until we were adults, anyway. And what about other kids? Well, it should surprise no one that I was set upon like a wounded sheep in a wolf pack. Children can be cruel and horrible, especially when there is a weak one around. And I was weak. And I had no real defenses. I was teased, tormented and rejected. And when I came home after being beaten, my parents would demand to know what I had done to deserve the beating. And they would punish me for having caused a problem. For making people think there was a problem in our home. So I learned there was no emotion that I could be allowed other than happiness. And I sure as hell didn't feel happy. And I learned that I was bad because I wanted other people's attention. And I learned that I should show no problems to anyone, because people would judge my family. And I learned that the problems I had were all my fault, including the beatings I took from other children. I think that one thread that runs through all of this is rejection of my identity and emotions. I learned that my true identity was inconvenient and unnecessary. This is a subtle thing. It is not like being beaten, but is a denial of my whole existence, of my ability to be an individual, of my right to exist. It seems so small, but years and years and years of this denial of my identity made me, well, let's be honest. It made me fucking crazy. Suicidal crazy. Mental hospital crazy. Electroconvulsive shock therapy crazy. Do you remember the 70s TV series called Roots? It followed an African American family, from their years in slavery to the present. The young African, Kunta Kinte, was being whipped, because he rejected his new name of Toby. The slaver would shout Toby, and whip Kunta Kinte, who would shout back Kunta Kinte. This is how dearly we hold our identities. Most people don't realize it, because no one has tried to steal their identities. There is something so sinister and terrifying about someone trying to reject or replace your identity. It is your very soul. As I review this, I see that I have failed. I think Miss Big Cool Planet is right. I cannot explain how I came to be what I am. The things I have said do not really convey the horrible desperation of my childhood. But emotional abuse is hard to understand if you have never lived it. The living hell of physical and sexual abuse seems easier to understand somehow. It is so obvious why it hurts so badly. But what made me was emotional abuse, a slow, relentless degradation of my very soul. That is depressing. Where do I go from here? I can't stop on such a crappy note. Well, I can say that despite all that has happened, I am me. I exist. And despite how twisted up and ugly I feel, I still have my identity. Mine. All mine. And you cannot strip away my soul. And I know that at least part of my ugliness is only in my mind, that my thinking is clouded. And like the poet Charles Bukowski, some of my ugliness, my brokenness, is part of my beauty. And like I said in my last post, I know I will return to pain, hiding and isolation. But today I am awake. I am courageous. Today I can feel again. I thank you for watching my video. It was very, very long and I still feel so much is bottled up. Please leave me a comment. It would mean a lot to me.
So, after watching that video, I'm sure you guys have a clear picture for this personality disorder. Okay, now let's see what is the differences between avoidant personality disorder and schizoid personality disorder. Individuals with avoidant personality disorder extremely sensitive to rejection, and because of fear of being rejected, they avoid socializing, avoid meeting new people, and have low self-esteem, a feeling of inadequacy, and feel unwanted. But for schizoid personality disorder, they are emotional detachment from society, coldness, apathy, lack of interaction with others, preferring solitude, being in their own world and being happy in it. They have very few close friends and minimally interested even in them and indifferent to pride or criticism. People with avoidant personality disorder, they wish to have close relation, but due to fear of being neglected, they back off and they avoid physical contact as well. But for schizoid personality disorder, they are opposite. They prefer introspection to outside activities, have no interest in sexual activities, and are indifferent to society. Lastly, Individuals with avoidant personality disorder have imposed self-isolation due to fear of being criticized. But people with schizoid personality disorder, they enjoy their solitude and are very happy about it, unlike avoidant personality who prefer company. So there is a very huge difference between these two disorders. Okay, so I hope that you guys won't make confused between these two disorders. Okay, now we are going to proceed to etiology of avoidant personality disorder. According to Milan, individuals with avoidant personality disorder born with such personality, the disorder may be related to environmental factors that are inherited. From the perspective of psychological, they might caused by rejection from others. How to how can we deal with this kind of personality disorder? There are few treatment that we can use. Okay, first is social skill training. Therapists may provide training for individuals with avoidant personality disorder for social communication purpose and improve social awareness and skill. Systematic desensitization, exposure, and medication are also used in this treatment. Okay, next, cognitive behavior model is the most common uh, treatment that we can see. Okay, therapists may assess, highlight, and try to facilitate the modification of the avoidant personality disorder patient-specific belief. They are focused on patient avoidant emotion. Group therapies are also have been used. Therapy use the group dynamics to test participant expectation for negative judgment and rejection. They connect with others in a meaningful way and learn social skill. Okay, now the next disorder I'm going to present is dependent personality disorder. Dependent personality disorder is an enduring pattern of disordered thought, behavior, and life functioning, a need of taken care by others, and a fear of being abandoned or separated from important individual in his or her life. They are seen as being clingy, which means they can't live without help from others. The characteristic for dependent personality disorder is pessimism and self-doubt. They tend to belittle their abilities and assets. They might constantly refer themselves as stupid. Individuals with this personality disorder may avoid responsibility and become anxious when they have to make decisions. People with chronic physical illness may predispose with this personality disorder. They may also feel fear when they are alone or helplessness. They have difficulty in rejecting others because they need support of or approval from others. So they are unrealistically preoccupied with fear of being left by others. The population of this disorder diagnosed between 0.5 to 0.6% of general population. Okay, now this is the diagnostic criteria according to DSM-5. Okay, I'm not going to read one by one. You can refer to page 320 in DSM-5 as well. So you can we can see that there are 8 diagnostic criteria in to diagnose this personality disorder. Now, What is the etiology of dependent personality disorder? We can see that biopsychosocial model of causation due to biological, genetic factor, and social factors, such as how a person interacts in their early development with their family and friends and other children. This may cause the communication pattern and dependent pattern of the individual. Psychological factor may also contribute to this personality disorder. The individual personality and temperament shaped by their environment and learn coping skill to deal with stress. Okay, so now what is treatment for us to treat this disorder? We can emphasize on individual dynamic psychotherapy, the emergence of a dependent transference toward the therapist should be addressed in a way to promote emotion growth. Therapists should also promote self-expression, assertiveness, decision-making, and independence. Assertiveness training can help the person with DPD to develop self-confidence. This may help them to develop a new attitudes and perspective about themselves relative to others, people, and experience. Okay, family, family therapy may also help in this to treat this personality disorder. Therapies can help family members initially develop a consensus on some models goal for increased autonomy for patient. Therapy can help to point out discrepancy between attitude of helping the patient and behavior that undermine this goal. Okay, now I would like to show you guys with a video that talking about dependent personality disorder. So I hope you guys will uh, pay attention in this video. Okay, please enjoy.
For people with dependent personality disorder, relying on others for emotional and physical support is much easier than relying on themselves.
Dependent personality disorder, or DPD, is a psychiatric condition that affects about 1 million Americans. The difference between a dependent personality and dependent personality disorder is somewhat subjective, which makes diagnosis sensitive to cultural influences such as gender role expectations. DPD is one of the most frequently diagnosed personality disorders. It appears to occur equally in men and women and usually appears in early to middle adulthood. Dependent personality disorder is marked by helplessness, submissiveness, a need to be taken care of and for constant reassurance, and an inability to make decisions. People with DPD find it difficult to make even simple decisions without the reassurance and advice of others. They often need other people to assume responsibility for major areas of their lives, and they tend to have difficulty initiating projects or doing things on their own. Because they are so reliant on others, individuals with DPD feel uncomfortable or even helpless when on their own. Similarly, dependent personality disorder comes with an intense preoccupation with and fear of abandonment. In an effort to avoid these feelings, people with DPD are extremely passive and agreeable with others. They avoid disagreements and may even tolerate mistreatment and abuse. Should their relationships end, people with DPD tend to move immediately into new ones to avoid being alone for any real period. There is no clear reason that a person will develop these dependent personality disorder symptoms. Although the exact cause of dependent personality disorder is not known, it most likely involves both biological and developmental factors. Some researchers believe an authoritarian or overprotective parenting style can lead to the development of dependent personality traits in people who are susceptible to the disorder. Regardless of its origin, the symptoms of DPD can be treated with psychotherapy, which is a form of counseling. Psychotherapy focuses on helping a person learn to be more active, assertive, and independent. Generally, short-term therapy is preferred as long-term counseling may lead to patient dependence on the therapist. Because dependent personality disorder may occur in conjunction with anxiety or depressive disorders, prescription medications may be used to treat these symptoms, in turn leading to a better state of patient well-being. Treatment for dependent personality disorder can be very successful, so talk to a mental health professional if you or a loved one is affected by the condition.
So, this video might give you a roughly picture of this dependent personality disorder, right? So after this, I would like to proceed to obsessive compulsive personality disorder. What is this personality disorder about? Individual with this personality disorder is perfectionism, a marked tendency to be interpersonally controlling, strong devotion to details, and rigidity. But these traits are also found in many normal people. However, individuals with OCPD show marked impairment in occupational or social functioning. Their relationship with others may be quite formal and distant. They have a high tendency to become upset or angry in situations in which they are not able to maintain control of their physical or interpersonal environment, but they could not express the anger directly. They are carefully hold themselves back until they are sure that whatever they say will be perfect. Their overall style of relating to the world around them is proceed through their own trait standard. They occur twice more in male compared to female, and it is between 2.1% to 7.9% of general population. But people with OCPD decrease in intensity with age. Okay, and now this is diagnostic criteria for OCPD according to DSM-5. Okay, so we can see that there are also 8 diagnostic criteria for OCPD. You can refer to the desk reference for DSM-5 as well for further reading. Okay, now I would like to show you guys the differences between OCD and OCPD. People tend to get confused between these two disorders. They may look similar, but actually they are different. Okay, from inside, individuals with OCD usually know their thoughts are not exactly reasonable, but people with OCPD believe their sky-high standard and work ethic are not only reasonable, but the only way to get things done. From perspective of distress, OCD are stressful and unpleasant. For instance, feel convinced you just drove over someone and cycling back dozens of times to check the body turns one's stomach into knots. But individual with OCPD, they will have the rigid schedules and rules of the condition are often comforting and feel right. Individual with OCD can feel guilt, but not always. They feel guilty about asking others to conform to their rituals. Okay, but Those with OCPD thinks that others should be conformed to their method and firmly believe they will become better. Okay, anxiety. Uh, People with OCD will will perform the action to reduce the anxiety, but someone with OCPD might make and review a detailed schedule in order to be comprehensive and efficient. So, anxiety is not part of the picture. For from perspective of time, individual with OCD would like to take more than an hour a day because there is right part of OCD diagnosis can be the fact that the obeisance plus the compulsions to neutralize the obation, so it will use up a lot of time. But individual with OCPD is more tightly interwoven to one personality. They rather than being an activity unto itself, the perfectionism and control of OCPD is more of a trait, but not a time consuming. Okay, now this is etiology of OCPD. It may cause by biology or genetic inheritance. The family environment does also play an important role in this personality disorder because perfectionism behavior might be reinforced by parents that emphasize of perfectionist. Child may only get pride from parents when they do something perfectly. Cultural factor may also play a role. Society or religion that are very authoritarian and bound by strict rules may impact early childhood development that affect personality expression. Okay, there are to treat this personality disorder. Usually, we are using a cognitive behavior model. Therapies often focus on short-term symptom relief and the support of existing coping mechanism while teaching a new one. Also, therapy might found focus on irrational thinking about imperfect, and this is to correct the obsessive thought. Okay, lastly, I would like to show an interview between experts about this OCPD. So please enjoy. It might take a little bit long.
Okay, well, hello, my name is Dr. Eric Hollander, and I'm with the Spectrum Neuroscience and Treatment Institute in New York, as well as Albert Einstein College of Medicine. And we're hosting the International College of Obsessive Compulsive Spectrum Disorders this week in New York City. We have a number of international experts in OCD and related conditions. And we're very fortunate today to have Professor Naomi Feinberg, who comes to us from the UK, where she runs the National Health Service program for treatment-resistant obsessive compulsive disorder. Uh, she trained at University of Cambridge and is with the University of Hertfordshire. And I thought that we would talk a little bit about obsessive compulsive personality disorder, where people don't really have a good understanding of that and how it differs from obsessive compulsive disorder itself, and what are some of the characteristics. And I know that you've also done a great deal of research looking at neurocognitive difficulties in people with OCD and obsessive compulsive personality disorder. So maybe we can start by just tell us a little about obsessive compulsive personality disorder. What is that?
Well, thank you for inviting me, Eric. And you're absolutely right. There is a great deal of confusion between obsessive compulsive disorder and obsessive compulsive personality disorders. I'm delighted to be able to talk a little bit about the personality disorder and try and tease apart the differences with obsessive compulsive disorder. Personality disorders in general are thought to represent pervasive problems with character and behaviour that start early in life and produce all sorts of difficulties, interpersonal and social difficulties for people. In the case of obsessive compulsive personality disorder, there's a pathological focus on orderliness, perfectionism, need for control, a focus on detail, and a difficulty with change at the expense of openness, flexibility, and efficiency, which really gets in the way of people functioning and getting on with their lives. The difference between obsessive compulsive personality disorder and OCD is that whereas people with OCD get involved in various ritualistic behaviours and have intrusive thoughts that they recognise as being senseless, be they checking or washing rituals or needing to get things right, in the case of the obsessive compulsive personality, the person really has a set of values and a sense of self that makes them feel that there is rationale for doing these behaviours. So they feel these behaviours are really very important. So they don't necessarily recognise them as being alien to them. Yet, by the same token, they're terrifically time consuming. They result in slowness, they inhibit people, and people with this disorder come across as being inflexible, rigid, and difficult to work or live with.
Mm-hmm. Now, what usually brings people with obsessive compulsive personality disorder into treatment? Why do they come into treatment?
Very often they come into treatment because they become unwell in some other way. A large proportion of people with personality disorder, about 70%, get depression.
Mm-hmm.
They also suffer with anxiety disorders. They suffer with obsessive compulsive disorder as well.
Mm-hmm.
And it's often these perhaps secondary conditions that bring them into treatment. But you know, it's really interesting that when you look in primary care and counselling, people with obsessive compulsive personality disorder are the commonest kind of personality disorder in that receiving treatment for mental problems. I think it's rarely recognised as being the primary problem. It's the secondary comorbidity that brings people into treatment.
Now, are these individuals difficult to live with, or are they hard to work with?
There are huge adaptive advantages in being meticulous and conscientious and workaholic, but there are also negative points. People feel a need to complete work before they can move on, so this really slows them down. They find unpredictable change very difficult, and they may get irritable and anxious and even come across as aggressive if they're challenged in that way. So they do come across as being judgmental, irritable, lacking a sense of humour, and inflexible. So whereas there are advantages in having these personality traits, if you have the full disorder, once it becomes more severe, it's actually very difficult to live with and to live with somebody with those problems.
Mm-hmm. So do they have a higher rate of divorce, for example, or do they frequently have difficulty on their jobs?
There's a high celibacy rate, and people have difficulty staying in work, people have difficulty with their marital relationships.
Mm-hmm. And this sort of rigid, perfectionistic pattern, does it start very early in life?
It starts early, present by adolescence, rather like OCD and the other obsessive compulsive spectrum disorders, and generally runs a lifelong course. Though it may possibly be amenable to treatments, but as you pointed out, people with this disorder, despite the fact that it's really quite common, very rarely come for treatment for that disorder. There have been very, very few treatment studies looking at pure obsessive personality disorder. It's usually treated together with some other disorder. We don't have a great deal of data on it.
Do people with obsessive compulsive personality disorder, do they have obsessions or compulsions?
Well, not strictly defined if you require the obsessions and compulsions, as I said, to have this ego dystonic, this alien quality. But they have intrusive doubts, they have intrusive thoughts, they have repetitive checking, repeating behaviours, needing to get things absolutely correct. So if you broaden the concept of compulsions and obsessions, they do have disabling repetitive thinking and behaviour patterns that are disabling.
Now, are there features of obsessive compulsive personality disorder present in other disorders? For example, people with Asperger's syndrome. Is it similar to the rigidity that you might find in that condition?
I think the phenomenological evidence that we have suggests that the difficulties that people with Asperger's in managing sudden and unpredictable change is very similar on the face of it to the difficulties that people with obsessive compulsive personality face. I think would be great value in trying to probe that domain and look at the similarities and differences. As far as I'm aware, nobody's actually done a head-to-head comparison of those two groups.
How about the issues of morality and scrupulousness? Is that characteristic of these individuals?
Yes, hyper-judgmental, hyper-moral, and that may talk to this need for completeness and perfection. That everything has to be perfect, oneself has to be perfect, and one judges others as needing to be perfect too. That there's a feeling of discomfort in the presence of incompleteness and imperfection, which drives the need for perfection.
So how do you treat people with obsessive compulsive personality disorder?
Well, there are various approaches you could use. There's interest in psychological techniques such as cognitive remediation therapy, which tries to target this focus on detail, a sort of information processing problem where people tend to look at the detail rather than the whole picture, and try and help people expand one's horizons by encouraging that and motivating them to deal with change and to get used to change. And that involves training exercises. The other form of treatment could be using a drug treatment commonly used for obsessive compulsive disorder, a selective serotonin reuptake inhibitor. And there's some data suggesting, in my experience, patients can become more flexible, less anxious, less rigid when treated with an SSRI.
Now, can you describe the neurocognitive impairment that's sort of characteristic of both obsessive compulsive personality disorder and also obsessive compulsive disorder?
Well, as I mentioned, there haven't been many studies in the disorder as a pure form, but the studies that have been done, and we've just recently completed a study, show some of the similar abnormalities in obsessive compulsive personality disorder that you see in obsessive compulsive disorder, namely difficulty shifting attentional set. So this is a difficulty with cognitive flexibility. People will focus on a particular stimulus and then have great difficulty shifting their attention to something new when prompted to do so. They'd rather stick with the same thing. And I think that really talks to the clinical problems that they show. It's hard for them to multitask. It's hard for them to move on. They get stuck on the same thing. Similarly, they show cognitive slowness on an executive planning task. They think longer about it before they make a move. And that's, again, something that this task is also impaired in people with OCD. So I think that shows an area of congruence. But there's also some rather new data suggesting that people with OCD actually have stronger persistence than people with OCD, and that may be an area of divergence, that they will persist for longer without reward.
Can that persistence be advantageous?
I suppose it's context dependent, but if you continue to live a life despite reward, it might lead to a very impoverished and impoverished existence.
Okay. So what are 3 points that you'd like to sort of emphasize to our viewers? What do you think is important in terms of a take-home message?
I think the take-home message is that obsessive compulsive personality disorder is common, it's easily confused with OCPD, it's likely to be treatable, and it's associated with a great deal of distress and disability and needs to be better researched.
Mm-hmm. Okay. Anything else that you'd like to highlight or cover? Or okay. Well, thanks very much for visiting with us in New York, and looking forward to the International College of Obsessive Compulsive Spectrum Disorder Conference.
Thank you very much for inviting me. My pleasure.
So, after watching the video, how do you feel? Is it you get more understanding about OCPD? Okay, so now I would like to conclude that there are 3 clusters in personality disorder, which are cluster A, cluster B, and cluster C. But other than these 3 clusters, there are also another personality disorder, and I will cover it now. So, another personality disorder consists of 3 domains, which are personality change due to another medical condition, another specified personality disorder, and unspecified personality disorder. So, personality change due to another medical condition is consequent of medical condition. An obvious changing from previous characteristic to new characteristic, but the personality changing do not occur during the course of delirium. The changing of personality cause impairment on social functioning, specified like aggressive types, paranoid types, nodal types, combined types, and unspecified types. Okay, and now another specified personality disorder is talking about individual does not fit into any of the other existing personality disorder category. Clinician does elaborate the specific reason for presentation that do not meet criteria of personality disorder. Example, mixed personality disorder may categorize as another specific personality disorder. And lastly, unspecified personality disorder. Personality disorder that does not meet the full criteria for any personality disorder diagnostic class. Clinicians tend to not specify the reason for criteria that do not meet specified personality disorder because does not fit into any of the other existing personality disorder category. And specified personality disorder may also cause impairment in social and occupational function. For example, for unspecified personality disorder is you do indeed have some the symptom of borderline personality disorder, but not enough to meet diagnostic criteria, or perhaps you have some symptom of BPD and some symptom of other personality disorder, may also categorize as unspecified personality disorder. So, here is end of my presentation, and before that, you all of you need to answer 2 questions, which is very not very hard, and the answer you can get from DSM-5 and this slide. So please enjoy the answering. Please enjoy the section to answering the question. So thank you for listening to my presentation. Bye bye.